Bigger, better, bolder. The cold, hard truth is taking talk to the next level. Right here on Bobo 89.1 FM, Cayman's Community Radio. We are still spilling the tea and committed to being part of the change that Cayman so desperately needs. Join Sandy Hill weekdays from 7:30 a.m. for Premier Access, Cayman Voices, Truthful Thursdays, and much more. Cayman's #1 talk show is now bigger, better, bolder, and more than talk. Getting results with hot topics, consumer reports, court exposés, and more.
I've come to set the record straight. I've come to shine the light on you. Let me introduce myself. I am the cold, hard truth.
Now, from the CMR studio in Grand Cayman, live, direct, it's the cold, hard truth. Now, join the conversation on 345-936-2626.
That number again is
345-936-2626.
All right, good morning, Cayman. Time to rise and shine. Happy Tuesday. We are in the saddle this beautiful Tuesday morning. Boy, I tell you what, the weather has been absolutely gorgeous. I see a little bit of overcast today, but that might be localized just to the Savannah area. Don't worry too much about it. We had a fantastic weekend, and we're going to talk about that after our Medical Rundown Tuesday segment, because, boy, I'm starting to feel the heat. I don't know about anybody else, but I am most definitely feeling the heat, and I'm going to tell you guys all about it in just a little bit, because, Cayman Brac was hot. Yes, I went to the Brac over the weekend and had a fantastic time. So let's go ahead and welcome our guests. We enjoy seeing and hearing from them every single Tuesday. Medical Rundown Tuesday, brought to you by none other than Health City Cayman Islands, with 2 locations now to better serve the people of the Cayman Islands and beyond. We've got Mr. Shamari Scott in the house. Good morning, Senor Shamari.
Good morning, Sandy. Good morning. How are you doing?
I'm doing great. How are you?
I am good. You said the weather was nice, so I was about to ask if you were outside playing pickleball, but forgot you said you were going to be in the Brac, so you didn't get any pickleball in there.
Nope, no pickleball there. I don't think they have a court yet, but they had tennis, and I was like, I'm on vacation. So I did a lot of walking, though. I'll tell you what. And that Brac heat is different.
Well, I'll have to listen in to hear all the activities that you actually did.
Yes, absolutely. All right. We also have joining us Dr. Naranjan, orthopedic specialist, of course. He is amazing. I can tell you from personal experience, consultant orthopedic and joint replacement surgeon. Good morning, sir. How are you?
Good morning, Sandra. I'm doing good. How are you?
I'm fantastic. I know every time I come to see you, it's about a pain here, there, and everywhere. But it's so good to have you on the program, Doc. And let me thank you always for, giving me such good advice. A lot of people think, if I go see the good doc, he's going to tell me I need surgery. And I can tell you that is not how the good folks over at Health City operate. They don't want you to run into surgery. They want you to do everything possible to avoid surgery first and foremost. It is an option. So there comes a point in time when you may not be able to avoid it, but I can tell you that that's never the first, line of like recommendation, really. It's always, no, let's get you in there and see what we can do in terms of you helping yourself, you getting physio, helping your body to do what it needs to do. So today we're going to be talking about some of the services available in relation to joint replacements. And sometimes, doc, you don't have a choice, right?
Yes, yeah. See, surgery is always last resort.
Yes.
And whenever we say surgery, we would have calculated the advantages and disadvantages. Every
Mhm,
surgery has its own risks involved with it. So we have
mhm,
to weigh the benefits of the surgery and leaving the patient as it is. And when we see that the benefit of surgery is much more than living as it is, that is when the surgical part comes into the picture. But
mhm,
if we reach that point, we try to use all the necessary means to either to delay the surgery, to postpone the surgery, to buy some time, and to optimize the function till
mhm.
the patient reaches to that stage.
Yes.
And before we continue, just to make sure I don't do Dr. Naranjan a disservice, even though he's been
Yeah.
on quite a few times, so people should know Dr. Naranjan by now. But he's our senior consultant for orthopedics and also joint replacement. He has well over 2 decades of experience in performing complex surgeries and also procedures, over 7,000 procedures,
Mhm,
from joint replacement of the hip and knee. And I know we're going to be concentrating on the hip today, as well as arthroscopic surgeries when it comes to sports medicine
mhm.
and the such. So, just a brief overview, but so people can understand the level of experience Dr. Naranjan has, as well as the numerous surgeries and procedures he would have performed in his career.
Hmm. No, absolutely. And we should also mention, Shamari, that Dr. Naranjan is part of an orthopedic team there at the Center of Excellence for Orthopedic and Sports Medicine. That is, they're all top notch, to be honest. Yes.
No, recently we have added two more orthopedic consultants at Health City.
Hmm.
So our team has grown, and now we are four consultants, and each one comes with their own expertise. They
Hmm.
specialize; they have more experience in certain areas, and then as a team, we will be able to cater almost all orthopedic conditions for the patients.
Yes. And of course, Health City Cayman Islands is recognized as a regional leader in hip and joint placement. Replacement surgery.
Mhm.
And, a couple times, Shamari, I've been to both locations now, but definitely the East End location. And I see people there and I hear a Caribbean accent, but it's not a Caymanian accent. And I engage with them. I said, "Oh, where are you from?" And gosh, they tell me all over Bahamas, TCI. So you really are bringing people regionally here to your facility to be able to assist them with some of their surgeries.
Oh, definitely. And just depending on the specific island and or country, there may be specific elements that would send. So, for instance, Trinidad sends us a lot of their pediatric cardiac patients that will come to Cayman. They only to two places, the U.S. and Cayman, in regard to those types of patients. So it just depends on a country. However, the one thing that seems to be consistent across all countries, even whether it's Central America, the Caribbean, US, and Canada, would be orthopedics. We get from Canadians, whether it's hip, knee, shoulder replacements, we get from the US as well. If it's the cruise lines, then it's varied, but from your regular self insured types of companies, we get a lot of orthopedics coming in as well. So Dr. Naranjan is not only busy with the local patients, but definitely
Mhm,
also with our international patients, as
In
you
in
mentioned.
In fact, it has become the opposite now.
mm,
The international patients, specifically for hip and knee replacement, are almost on par or maybe more than the local patients now. Uh,
wow.
the medical tourism is picking up pretty good over a
Yes.
period of last 3 to 4 years. It has grown up pretty significantly. In fact, as we speak, this week I'll be operating four hip replacements,
Mm,
and in that, one is from Cayman, one is from Saint Lucia, another one from Bahamas, and another from
mhm.
Canada.
Wow.
So it feels nice that people come all the way from Canada, from Bahamas, Lucia, for to get this replacement, and they trust in our institution. They're happy with the island as such, the friendliness, the safety, uh,
Mhm,
the communication, the language, everything matters for this growth.
mhm, mhm. Absolutely. All right. And of course, we're going to be talking about some of the technology that you guys are using as well to really, physician assisted, to really make your procedures easier on the patient, easier recovery time, and
And
easier success stories as well.
and
Much
Yeah.
Sandy,
better.
just to mention,
Mhm.
Dr. Naranjan raised a great point, and I recall when we first started, and I was traveling to understand and look at what we would have as the benchmark for medical tourism, and
Mhm.
SEMA as well as Clínica de Biblica in Costa Rica
Mhm.
were two medical facilities that had decades upon decades of experience being in medical tourism. And when you read different case studies and such, a lot of times one of those two on this side of the world would be used as the examples of medical tourism. So
Mhm.
going there under the guise of a medical conference, hiding my Health City badge, and actually getting tours of those facilities. Obviously, I asked questions, and between both, the one facility that had the most medical tourists, when I asked what percentage from a local versus overseas perspective, it was 20% of their surgical volume was from overseas and 80% was locally. So the fact that you're hearing that we're doing more or the same from overseas versus local speaks volumes to the medical tourism that we've been bringing to the Cayman Islands over the last decade. Well, now going to be 11 years. And just shows you that we are doing what we said we would do, and we're bringing in medical tourism not just from the U.S. and Canada, but from all over the Caribbean, Central America. And if you look at our actual stats, we've seen patients from over 150 different countries that have
Mhm.
come specifically for the medical services at Health City.
Hmm. Fantastic. All right. Well, let's get into some of the details, folks. We're going to be talking, and good morning to everyone. We're going to go through some of your messages. A lot of you saying that you really missed me, and it felt like it was a whole week or more that I was gone for. But let's talk about some of the key advances and benefits of this computer navigation assisted hip replacement. Again, technology. We know in the past that Shamari has told us a lot about the state of the art procedures that will help to, restore mobility, reduce pain, improve the quality of life. The orthopedic team gets the benefit of state of the art technology, just like the maternity and NICU units. Everyone at Health City, they've done a phenomenal job, I must say, Shamari, of sourcing different equipment to be able to bring in here to make sure that their physicians have top notch and access to top notch equipment. People overseas, everyone. I mean, it's just absolutely amazing. So let's talk about this particular piece of equipment now, computer navigation assisted hip replacement. What is this all about?
Sandra, this is like a GPS for your car, in simple words. So what
Mhm.
it does is, I think you can see it on the picture. You see
Mhm.
like two eyes and a screen,
Mhm.
and the eyes are the sensors which will be picking up the data from the
Mhm.
patient. It's so what we do
Mhm.
is, before starting the procedure, we mark the landmarks of the pelvis, of the thigh bone, where exactly is the socket, where exactly is the ball of the hip joint. So the instrument, what you see on the picture, it knows exactly in the space where exactly is the socket and where exactly is the ball. In addition to that, it also knows the joint and the alignment of the patient. So when we open up the hip joint, and then when we want to say clean up the socket and place the real implant into the socket, we have to rely on various factors. For example, the anatomical landmarks, what the surgeon sees or feels, will be one of the ways by which we can know that, okay, this implant has to go in this alignment, maybe in this degree of antiversion, or in this much millimeter it has to go inside. So we calculate that based on our visual guidance, and which is
Mhm.
a subjective thing. It can vary based on the surgeon's perception of what's happening there. There may be blood, there may be tissues which are covering the area. The patient might have tilted a little bit while doing the surgery. All these things will not be taken into account when surgeon decides based on the visual input.
Mm,
Then the next input is like you take an X-ray on the surgical table that gives you an additional input where the surgeon can rely on two inputs to put the implant exactly in the correct place. Now,
mhm,
this system, which is a Smith and Nephew Corey system, Center Orthopedic Real Intelligence System. So this system, in the real time, it tracks the patient, any minor movements in the patient or the body or the pelvis. It registers that and it gives back input to the patient like a GPS. And so now the surgeon has three inputs: one, his own experience and his input,
mhm,
maybe an X-ray input, and also the computer assisted navigation input. So when all the three inputs combine together, the chances of error or placing the implant in a suboptimal position is almost zero. Uh,
mhm,
so this helps in achieving the perfect anatomical placement of the implants as we plan before the surgery, and that leads to outcome in the long run. I mean, at least in theory, definitely it's going to give a much better outcome compared to conventional replacement. But the long-term results we have to wait and see.
mhm.
But with all the whatever we are doing, we are seeing that the implants are looking great on X-ray. The position is perfect by using these newer technologies.
Mhm. Wow. I mean, this is, I'll tell you, Shamari, I hear so much about things like, AI and all these tools really converging. And it feels like to me, I mean, being a physician, this is an amazing time, doctor, to be alive, to have all of these tools available to you that can really help you do an amazing job for your patients. Can you tell us a little bit about, because I'm sure sometimes you sit back and think, Dr. Naranjan, he looks young, but he's an experienced doctor. So you don't get to that many surgeries and all those years of experience. He's been doing this for quite some time. Do you ever look back and think that you never imagined seeing this type of technology being available to help you guys as physicians and as surgeons?
Yeah, no, this is a interesting topic, and it's very fascinating to see how the medical field progressed. I joined orthopedics in 2001, so it's been now 25 years into orthopedics.
Mm-hmm.
So after the medical school, so the way I remember orthopedics in 2001 was way different than now. So that time, like for example, a hip replacement patient, we used to give, say, antibiotic for 10 days, keep them in the bed for 10 days. We keep a big pillow to keep their leg in one secure position so that it doesn't dislocate. Uh, there were so many complications like fracture and dislocations. We have seen it all. And
Mm-hmm.
then we have seen the improvement with the implant technologies. So they started getting newer materials, newer designs, more bone preserving, long lasting kind of materials started coming into the market. Then we said, oh wow, this is a great improvement. And then we saw the next generation, like we started seeing the newer approaches to the hip replacement, which will give faster recovery. Then we started seeing the days in a patient spend in the hospital is reducing from 10 days to 1 week to 5 days.
Mm-hmm.
So that was a great improvement. And then of late, last 3 4 5 years, the navigation has come into the picture, and now it is like this is a totally different leap into the technology. And 2001, I would not have imagined that all these things can exist. um, and now here we are. But at the same time, I feel fortunate that we are in this phase where we have seen the old and we are transitioning into the new.
Mhm.
So we have the best of both worlds. So if for some reason if the instrument doesn't work, I know how to go and then fix everything without the instrument.
Mhm.
So that's the best part.
Mm, yes. All right. Fantastic. Folks, don't forget if you have any questions for the good doctor this morning, 936-2626 is the telephone number. Lines are open and you can certainly feel free to call in. So let's talk about some of the key advances and benefits. This daycare hip replacement procedure. Tell us what are some of the key things that people can look forward to?
Yeah, so I was just mentioning that previously we used to admit for a very long time in the hospital
Mhm.
for the patient to recover, and the duration of hospital admission is coming down significantly.
Mhm.
Now, 90% of my patients go home within 24 hours. So if I do the surgery, say today, say at 9 o'clock, they walk within few hours. And if the patient is fit and they're healthy in general, I don't mind sending them home on the same day. So they
Mhm.
can come in the morning, get the hip replacement done. They can go back home walking with the help of a walker on the same
Mhm.
day. Of course, we don't use that for all the patients. We have to select our patient. The patient has to be motivated. Um, and if we find that kind of patient, we will do a daycare. But otherwise, all the patients, if you compare overall the number of patients, 90% can go home the next day by afternoon or by evening. So, which is a great improvement compared to what it was, say 5 years or 10 years back. There are multiple factors which have contributed for this improvement. One is the incision. So we use no muzzle cutting approach, and that gives less pain and faster recovery. And because there is no muscle cutting approach, the chances of dislocation or a lot of bleeding which may happen otherwise can be reduced significantly. uh,
Mhm.
and the implant, the newer technologies, all these things make us cut very less and then put the implant inside. That also adds to the faster recovery. So all
Mhm.
these things have made us send the patient early. Now, what are the benefits? The benefits are the patient's recovery depends on how they think mentally.
Mhm.
If they think it is a major surgery, they tend to rest more, they tend to depend on others more, they
Mhm.
tend to baby it a little, and then the recovery gets slower.
Mhm.
On the other hand, if the patient thinks that, okay, this is a minor surgery, and the doc has told me that this is nothing major, you can go ahead and walk on the same day, then they tend to recover much faster than the other subset of patients.
Mhm.
So, if we send the patient on the same day, they think that this is a routine surgery. It's a day we went to the hospital, got the surgery, came back home,
Mhm.
a familiar space, they know, and they feel normal. They don't feel that they are patients. So
Right.
that makes a huge impact on the recovery of from the surgery. So we are more towards fast surgery, fast sending home in selected patients. Yes.
Mhm. Hmm. Fantastic. It's so interesting when you talk about the mental element of this, really putting the patient in, as we would say, a good headspace for them to have the best possible outcomes and recovery. So fantastic that your physicians are thinking about all of these things. Let's talk a little bit about this now bilateral hip replacement. What's that?
Okay. So see, when we do a knee replacement, many surgeons they prefer to do one knee replacement, and then they
Mhm.
call the patient after 6 weeks or after 3 months for the other knee replacement, which makes sense in high risk patients. And also when the whole team is not supportive enough to handle a demanding surgery like two knee replacement at the same time. So if the anesthesia team, if the physicians team, if the physical therapy team the surgeons, if they are all competent, and if they can assess the complications and prevent them before they happen, then
Mm-hmm.
we can do two major surgeries, like two knee replacement at the same time.
Mm-hmm.
And the hip replacement goes to the next level. So there are very few people in the world actually to do both hip replacement at the same time. It's not that the surgeon is not, he cannot do the surgery. It's about the anesthesia, and it is about the whole team which has to be geared up for catering two major procedures at the same time. So in Health City, we have done quite a few both hip knee replacement at the same time. So patient goes into the operation theater, one anesthesia,
Mm-hmm.
and both hip replacements will be done. And the patient will walk the same way how one hip replacement is done. They walk on the same day, and maybe in 1 or 2 days they will go home. We don't send them on the same day with both hip replacements, but they will be able to go home within a couple of days. So, in selected patients, this cannot be done for everyone, but in selected patients who need both hip replacement, this can save time. This can speeden up the faster the recovery. And say after the hip replacement, if one hip is bad, the other hip is good, they will not be able to walk. They will still be in pain. And for those patients, this definitely helps. And the key factor in this is the team. So if you have a good team, you can go for this kind of procedure.
Mm-hmm. Mm-hmm. Hmm. Fantastic. All right. So, wow, both at one time. All right. Subject to some conditions, obviously. What are
Yes.
some common issues then that are treated with the the hip replacement surgery?
See, the hip replacement usually advised for two conditions basically.
Mhm,
One is arthritis, and
mhm,
the second one is a fracture.
mm,
So, if arthritis because of any reason, it can be because of old age,
mhm,
it can be because of the hip impingement syndrome, which was there from a young age, and then over 10, 20 years, when they reached 45, 50 years, they ended up having arthritis. And even that's called a secondary arthritis. It's happening not because of old age, it's happening because of some other condition. Or it can be because of rheumatoid arthritis leading to hip damage, or it can be because of lack of blood supply in the hip joint, which can lead to arthritis. So there are so many conditions where the hip can get damaged, and then that is one of the indication for hip replacement. The other indication is, suppose if a patient has osteoporosis, where the bones are very weak,
mhm,
and they fall down at home, or it can be as simple as a simple twisting injury when they're trying to get up from bed or from chair, that can lead to fracture inside the hip joint. And at that age, we don't want them to be in bed a longer recovery, because we want them to be as active as possible to prevent other complication which can happen in that age. So we replace the hip joint instead of say fixing the fracture, so that we can make them walk on the same day. And the hip is going to last for next 25, 30 years, and they will recover soon, and all the complications can be avoided.
mhm.
So normally hip replacement is done for these two conditions.
Hmm. Okay. Very good. And let's talk about how common are these hip fractures? I know that obviously, after you have gotten, to a particular age, they're more likely to happen because of, just bone density as we age
Yeah.
really does change. And the osteoporosis is something that especially women in particular have a real concern around. So how often do you see people fracturing their hips?
If I have to give you, say, a ballpark figure, so if I do say 6 to 7 hip replacement for arthritis, there is definitely one hip replacement done for a fracture. So out of the all the hip replacement which we do, at least 20% or 15 to 20% will be because of the fracture, and which is a significant number. And nowadays, I have even seen like people go to play pickleball and then they take a shot and the hip is broken. Uh, and so this is kind of alarming because um, we don't know about. We check our glucose, we check our cholesterol, but we
Mhm.
don't check our the bone quality, and we don't spend time to kind of protect the bones with exercises, losing weight, and other lifestyle modification. And finally, the end result is the hip fracture.
Mhm.
So it is pretty common. As the age progresses, the incidence is going to be higher and higher. It is rare to see below 65 years, but after 65 years, depending on the bone quality, it can be pretty significant.
Mm. Doc, I don't know why you had to mention pickleball. I'm just saying.
No, I just wanted to tell you that it's not just the pickleball. It's the bone quality. So you can go and play your pickleball. Don't
Yes,
worry about.
please
No,
pick it up.
okay.
It's not a sport.
Let me tell you one more thing. If I see 100 people who are playing pickleball, the chance of hip
Yes.
fracture is less in them compared to those who don't play at all. Okay, maybe that helps you.
Yes. Very, very good. And of course, the things that we can do, like I said at the onset of today's show, is, you always tell, like when I came in and saw you, I've got shoulder pain. Sometimes I've got knee pain, nothing in the hip yet. But, you will say to me, right, we'll do some x-rays, but look at what's happening and going on with your neck. And you already see some things that are compromising, I guess, the vertebrae or whatever in that area. And then right away, you say, listen, there's physio, there are things that you can do to strengthen and give yourself a much longer time before we might need any surgical intervention, or maybe you can even offset it entirely. So these are the things, folks, if you get ahead of it, my recommendation is to, never ignore pain, because I know we kind of get used to pain. It's so funny how pain works. But sometimes when you go in, the physician goes, right, how long have you been dealing with this? And you go, oh my gosh, it's been months now. Because we kind of get in this mode where we ignore it, we'll pop a painkiller and just try to move along. And I think the important thing really is don't ignore pain, because that's an early warning sign that something could be amiss. And so when you go and you see the orthopedic team, they'll tell you, like, okay, it's not that bad yet. You're having pain because your body's trying to tell you something's going on here, but here are the things that you can do to help yourself, help your body recover, and so on. So El Ray has a question. He says, can you run/jog after recovery of hip replacement? So this is a very good question. Are you able to get back to life fairly normal?
Yes, with the recent implants, it depends on what kind of implant we have put. There,
Mhm.
there are metal on the plastic kind of implant. There are ceramic on the plastic type of implant, and then there are ceramic on the ceramic type of implant. So depending on the type of material what we use,
Mhm.
the activities what they can do vary. So if I see a professional athlete, I'll be using a different type of implant versus a person who is not a professional athlete,
Mhm.
because each implant has its own plus and minus. So we have to tailor the implant to the needs of the patient. So if the patient wants to run or jog after the hip replacement with the modern implants, definitely yes, they can do it.
Mhm.
But do you, I mean, if they want to do it for exercises, definitely yes. But if they want to do, say, full marathon, or if they want to do some kind of high impact activities, I usually say no, because some of these implants are not meant for that kind of repetitive movement, and they can. Instead of staying having a life of say 25, 30 years, they
Mhm.
can come down to say 15 years or 10 years depending on how you use it. So yes, they will be able to run, they will be able to play pickleball after the hip replacement.
Mhm.
And yes, the important thing is not just the hip replacement, the important thing is how well you strengthen your muscles after the hip replacement, how good your balance is in general, So all these things matter for the patient to go back to the sports after the hip replacement, not just the implant alone, but there are a lot of factors to make the patient fit for the activities like that. But it can be done, yes.
Mm-hmm. All right, very good. Miss Evangeline says Dr. Naranjan and Dr. Anthony Vincent are simply the best orthopedic doctors. I had 2 knee replacement and I'm doing great. Well, thank you so much for that testimonial. Lavana says I currently have osteoarthritis in my left hip. I've done 2 cortisone shots, but after a while it wears off. How affected is the gel shot? I'm supposed to be getting that today, and my back surgery is doing great, but now I have another health issue. So she's asking specifically, what is this gel shot that she's referring to?
So what she's talking about is hyaluronic acid. It's a thick jelly material. It is injected into closed spaces like hip joint or knee joint, and rarely to the shoulder joint. The theoretical aspect of that is it is so thick that it can act as a lubricant, and it stays in the joint for some time. But what we see practically is it's not a miracle injection. It helps in some patients, and it can help really good depending on their body weight, depending on the stage of the arthritis they are in. So for some patient, it really may not make any difference. It's an expensive injection. It costs over $1,000. As long as patients are aware that it may or may not work, it is worth taking those injections. If it works, fine, you buy 1 year time or 6 months time with that injection. If it doesn't work, yeah, you are now you are more sure that you can go for the next step, which can be surgery. So either ways, yes, it works. But most of the times, the insurance do not cover the Synvisc injection because there are only a few criteria where it may work. So they have to fit in that criteria, and then only the insurance approves this injection. So yeah, the injection works in few patients, and in few it will not work. But usually it doesn't give any harm, and yeah, it can be taken. Yes.
Okay, we do have a testimonial, a story here from one of your patients. So we're going to go ahead and cue that in. And Lavana says, yes, it is expensive, and the insurance also doesn't cover it. So her insurance doesn't cover it. Oh my goodness.
Yes.
Wow. Yes. My. All right, let's have a look at this testimonial video.
When I get home, I'm going to look forward to dancing on the tables again. Well, this is what I tell people when I'm being wheelchaired around and with a stick, and you think, oh dear, this is not me. And, you know, I say, they promise that I'm going to be dancing on the tables again in a couple of weeks. I needed a hip replacement because I have arthritis, and I was warned at the time that I'd probably need both hips to be done. So the first one was done 13 months ago, and this time I've just had the other one done. And it's been the same speedy procedure. They get me up and walking within a few hours, and you think, oh my God, how am I going to do this? But actually the physiotherapists are wonderful, absolutely wonderful. They said my muscles were in great shape, so I was ready for the operation, and I seem to be recovering very well. The amazing thing is that being here, by day 2, people seem to know who I am. And I pass people in the corridor and they say, hi, Miss Patricia. And I'm going, who's that? But it really is wonderful. The nurses, the doctors, they all tell you very clearly what's going to happen to you before they do it. They take great care and don't rush anything. And that makes one feel very, very looked after. I've been staying in Parrot Ridge. And the wonderful thing about Parrot Ridge is the views are absolutely spectacular. And of course, it's right next to the hospital. You're only minutes away. It's a wonderful hospital. And that's why, after my first experience, I decided to come back again. Because I actually could have gone and had it done in the UK under the National Health. But I chose to come here because I'd had such a good experience the first time. I'm really looking forward to getting back, actually, because I have a new granddaughter, my first granddaughter, and she's absolutely adorable. And we've been doing FaceTime, and she recognizes me and she waves at me, which is really cute. I shall be singing her a song which my mother used to sing to me. Fairy tales will come true, it'll happen to you if you're young at heart. I've forgotten the rest of the words.
Well, amazing video. Again, really demonstrating how many of your patients have just benefited from having a wonderful experience at Health City Cayman Islands. And of course, those who are doing hip and pelvic procedures are certainly no different, Doc.
Thank you. Yeah.
And
right.
once again, just to solidify the point that the young lady could actually have gone, would have been in the UK and obviously within the system and could have gotten it done there, but chose to fly across seas in order to make sure that she could have it at Health City, Cayman Islands. So once again, kind of reminds me when we're in tourism, we say, we just need to get you in once, right? And we know you're going to be a repeat visitor. It's the same thing with Health City. We get you in once. And when you come and have a great experience, the next time you need, or if a friend needs, or if you're talking to someone, you're overseas, you definitely tell them about Health City in the Cayman Islands. And we get a lot of repeat visitors who are patients coming to get, if they had one knee and years later they need the next knee, they're sure to show up at our shores and our doors.
Wonderful. All right. And some other common issues that are treated, revision hip replacement. Now, I've heard of this where sometimes people have had a procedure done and, it's not successful. So they actually have to do it again.
Yes. In fact, we are seeing the revision hip replacement more nowadays because one, all the countries in the Caribbean and whoever is sending patients to us, there are a lot of primary hip replacement being done by multiple surgeons. And not necessarily everybody's volume will be the same. And depending on the number of cases they do, sometimes it may not be as successful as someone who is doing them on a regular basis. So we are getting a lot of patients who need a revision surgery and make them walk again, be active again, and get rid of their pain. This is one subset of patients who are coming from multiple countries. And if you see, these patients don't have many options. They either have to go to US or some in the Central America, or they have to come to us. And the compassionate care, the expertise, the cost, everything is in our favor. So we are seeing a lot of patients coming from different islands to LCT for revision hip replacement. The revision hip replacements is a totally different ball game than the primary hip replacement. It requires a lot of expertise. It requires a lot of patience from the patient's perspective, from the doctor's perspective, and it requires a lot of commitment from the institution perspective because things can change during the surgery, before surgery, and after surgery. And if someone comes for a revision hip replacement, and then we say, okay, we didn't expect this to happen, and it happened, you have to pay another $15,000. Then it's very difficult for those patients who have come. So the institution plays a big role in kind of supporting the patients and the doctor in complex procedures. So at Health City, we have a very good balance of all these things. Our institution supports if there is a little here and there with the procedure, and if the patient needs a little extra, maybe a day extra admission, maybe some extra procedure, the institution is always backing up the doctors, and they say, okay, whatever needs to be done, you go ahead and do it. We will take care. We will think about the cost. We'll think about all other issues later. But what needs to be done for the patient, go ahead and do it. And
Mm.
that liberty for the surgeon, it's a big thing. And when we get that kind of support, we can go ahead and handle these kind of patients.
Mm.
Also, the team in revision hip replacements, the bleeding will be more, the surgical duration will be more, the anesthesia time will be more, and post-operatively, they might need ICU management. So all these things needs an expert team and who are flexible and who are willing for a suggestion. So it's a teamwork, and we are fortunate to have that kind of team here.
Mhm.
And if I see the number of revision cases which we were doing, say 10 years back and now, at least we have increased it by 2 or 3 times in the last 10 years. That tells us that gives us an overall picture of the increasing amount of the patients who need revision hip replacement, and
Mm.
also their trust in us to come and get it done here.
Mhm. Yes, and I've seen people who have actually needed the revision hip replacement, and occasionally it's very very rare, but sometimes it's actually the part itself. So when the patient went in, one of the first questions they needed is all the information on the actual part, like the serial number, the model number, all these things to ascertain if there've been any recalls or issues with those. Because as physicians, of course, you guys keep up on that type of information. So people have to remember that what you're actually doing is you're taking something that's foreign to the body and you're, basically building them the hip joint, right?
Yes.
So that's a part, that's an actual physical part that goes in there.
Yes, so that is the reason why we don't compromise on the implant quality.
Hmm.
So most of our implants are made from Smith and Nephew company, Arthrex company in arthroscopic, Smith and Nephew and Arthrex, and Zimmer. So these are the top companies in the medical field, and we use those implants only. We don't compromise on the implant quality, and the patients will get a metal card after the procedure,
Hmm.
which shows what kind of implant was used, what is the serial number of the implant. And if you put that serial number, anybody anywhere in the world can know what was used, what is the make and model, whether there are any issues with that. So
Hmm.
all these things are important. Um, yeah. So and in the revision hip replacement, it is not only the implant. Many times the revision cases are done because of osteoporosis. So the patient uh, bones, they keep on becoming more and more weak, making the implant loose. Sometimes the patients can fall again after a hip replacement, breaking the bones in and around the implants. So we have to take them out and do a revision procedure. And we always ask the patient, can you get the original implant details? So if the socket is good and if the thigh part is broken, we don't have to replace the socket all over again. If we get the correct implant, the serial number and everything, we can find an implant which can match with that, and then we can only replace the part which is damaged, not the
Hello,
whole.
good morning.
Yes, hi, good morning.
Good morning, Miss Sandra.
Morning.
Are you on the here?
Yes, we're on air with Health City Cayman Islands.
Okay, I'm sorry. This is Bev's sister. I wanted to talk to you off the here.
Okay, all right, I'll call you after the show.
All right, thanks.
All right, my dear, thanks. All right, sorry about that. We just had someone jump in on a WhatsApp call. So it could be a number of different things that is happening why a revision hip replacement surgery is needed.
Yes, yeah.
Yeah,
And
and
we
of
don't
course,
do, yeah, we
yeah.
don't do the revision hip replacement like the primary. We don't rush them
Mhm.
out. We don't. So it's more about safety and making
Mhm.
them everything right, avoid any
Mhm.
complications,
Mhm.
what for bleeding, clots, everything. So we take it slow when it is a revision hip replacement.
Yes.
Yeah.
Yeah, because basically you're in a position where the first one, for whatever reason, hasn't been entirely successful. So there's added risk when you're doing a revision hip replacement.
Yeah.
Yeah, like any other surgeries, really, when you think about it. All right, tell us a little bit about bursitis. What's this?
Okay, so bursa is nothing but a sac, which usually will be near the tendons or the joints. Normally, when the joints move or the tendon move over the joints, there will be friction, and body doesn't want the friction. So what it does, it secretes a sac filled with fluid, which acts like a cushion, like an airbag, and then the tendons can glide over the bursa without getting damaged. So this is a normal mechanism, defense mechanism for the body.
Mm-hmm.
Now imagine for some reason the friction increases. So what body has to do? It has to increase the fluid in the bursa to accommodate for that friction. And what it does is it secretes a lot of inflammation mediators, a lot of fluid there, which triggers pain. And patients come to us with inflammation and pain in that area. And in the hip, commonly, as you see in the picture, on the side of the hip, there is a trochanteric bursa that commonly gets inflamed. So most of the times, this can be managed with anti-inflammatory medications and physical therapy. So the inflammation reduces and patients will be fine. But if this happens again and again, then we need to think what are the causes which is increasing the friction in the first place, which is triggering this inflammation. So most of the times that cause is because of weakness of hip muscles. So the hip abductor muscles will be weak and the IT band will be tight, causing more stress over the tendons, which are moving over the hip joint, causing inflammation. So for those who are getting this repeatedly, we ask them to go to a therapist and then ask them to strengthen the muscles, which are going to stabilize the hip, and that will solve the problem. And yeah, sometimes they need a quick start. In that case, we can also give a cortisone shot to the bursa, which can reduce the inflammation pretty fast, and then they can go for the physical therapy to strengthen the muscles. Yeah, but we don't usually operate on such conditions, but this is one of the common condition can be managed conservatively.
Mm-hmm.
But the problem is it is very difficult just with the symptom to know whether there is an arthritis or there's a bursitis in the hip. So it is better to come to the doctor, get an X-ray done, see what's happening there. If the hip is normal on the X-ray, then it's bursitis, and in that case, it's nothing serious. It can be managed with strengthening.
Mm-hmm. All right, very good. And we also have, oh gosh, I don't know if I can pronounce this one, but let me try because these long words give me a linguistic challenge. All right, let's see, Doc, if I can do it. Femo, okay, hold on. Femo roastabler.
Yes, you just have to add all of them together. Yeah.
I don't know if I can put it together, but tell me, how do you pronounce this long word?
It's femoroacetabular impingement syndrome, FAI.
Oh
So
my goodness.
this is a condition where, see, suppose if there is a ball and a socket, and the ball moves in the socket. If the socket is a little big, it kind of rubs the ball. Or if the ball is kind of little big, it rubs the socket. So this condition is nothing but friction between the ball and the socket of the hip joint. And this condition starts pretty young in the sense in adolescent age group we can start seeing this condition.
Oh, wow.
And most of the patients, they come to us maybe when they are 20, 25, 30 years of age with constant pain in the groin. So their typical complaints are, see, I cannot sit for a long time, I need to stand up to relieve. I cannot drive in a small car because I have to bend and sit for a long time. And as I stand, the pain gets better. But when I sit for again half an hour or 1 hour, it comes back. So this is when I hear this kind of symptom and the patient is young, and especially if they are active, then we do keep femoroacetabular impingement syndrome as one of the differential diagnosis. And we do CT scan, MRI scans, or X-rays, depending on the need. And finally, we make this diagnosis. Now, it is a mechanical issue. There is either the bone on the ball of the hip joint side or the socket of the hip joint side is grown, and that is why they're getting the friction. So we begin with physical therapy, but most of the times, if the physical therapy doesn't work, these patients need hip arthroscopic surgery, and to clear that extra bone and free the joint. And it is important to pick up this condition, because if we leave it as it is, give them some painkillers, and then tell them, okay, you just do some physio, some painkillers, and then 10 years down the line, they come back to us with proper hip arthritis. So a small keyhole surgery which can fix this problem at the age of 25, if left alone, may need a hip replacement at the age of 40 instead of getting a hip replacement at the age of 65. So this is something which has to be kept in mind in young active athletes with joint pain, which worsens when they're sitting down.
Okay. So the approach then is to treat it. You said this arthroscopic and open surgical correction. Treat it while they're younger so that it doesn't develop into the more serious condition when they get older.
Yes. Right.
Okay. Very good. All right. Pelvic and hip fractures. We talked about hip fractures earlier. Lots of people have, trip and falls, especially as you get older. Sometimes your mobility is compromised. You just don't see something, you trip, and the one thing that seems to want to break every time you fall seems to be that hip. Why is it that there's so many hip fractures as you get older?
There is a lot of force which is passing across the hip joint. There are big muscles which are attaching just below the neck of the femur, which is just below the hip joint. And the hip joint itself is a ball and socket joint. So it's nice and snugly fitting in the socket. So when there is a fall, all the force goes to the weaker spot, which is between the ball and the attachment of the muscles. And this is the area again where the bone gets reabsorbed pretty fast. And that is the reason why the fracture happens at that area. The other common areas which can have fracture because of osteoporosis is the wrist joint. We call it as Colles fracture. So someone, when they fall, if they give support their hand, body with the hand, they can have a wrist fracture. Then there are spine fractures, which can happen because of osteoporosis. So when we do a bone density test, we always concentrate on the hip bone density, the wrist bone density, and the spine bone density. And that gives us overall risk assessment, whether it can happen in the wrist or in the hip or in the spine. And what is the overall bone quality when we average all those bone density things. And then based on the bone density parameters, we encourage the patient to build that bone. It is hard to build at that age. It requires medications, exercises, lifestyle changes, weight reduction, all of them. On the other hand, preventing bone to go for osteoporosis is easy. And it has to start when you're young. So it cannot start when you're 60 at 60.
Right.
You have to start early. The more exercises you do, the more muscle mass you have when you are young, the lesser the chance of osteoporosis when you're old. And even if it happens at a later age and to a lesser extent. So exercises when you are young is very important to prevent osteoporosis when you're old.
All right, folks, you heard it. Start young. All right. So Shamari, let's bring it back now full circle and talk about the impact of medical tourism here in the Cayman Islands when it comes to the economy, really. This is really quite impressive. Uh-oh.
My
Just
mic
a-
was muted.
There you go. Yes, sir.
um, but no. Just saying that shortly enough we'll be circling back to have a discussion about our economic impact
Mhm.
assessment that was done. But through direct and indirect, it's over $1 billion of impact that would have occurred based on Health City being here. But as you can see, and as I mentioned before, the one specialty that seems to actually be a common thread through all of our target countries, as I would state it, is actually when it comes to orthopedics and the joint program and the hip program specifically, just due to the level of expertise, really is one of the areas that's helping to lead the way. And we look forward to treating all of our medical tourists that come in. But as Dr. Naranjan said, obviously it's a safe country. One of the reasons why it was chosen. We have, great infrastructure here. Then obviously Health City with the expertise, as well as our ability to have pricing that bundles so people have some level of certainty before they come, whether it's their insurance company, their governments, or we also see quite a few self-pay patients coming in, especially for instance when they're coming from Canada, just because it would otherwise be covered within Canada. I have quotation marks you can't see, free of cost, but through their taxes, they actually have access to healthcare where they wouldn't need to pay out of pocket. So if they are traveling outside of Canada, they do need to pay out of pocket. And because of the attractive nature of our costing, they're able to come to us and actually gain the benefit of that costing and expertise here at Health City Cayman Islands. So we just look forward to the next decade of what we're going to be able to do, not only for our locals and our residents, but also for our medical tourists that travel specifically to see us. And we would have celebrated our 11th anniversary. And once again, special time. So we are offering our executive health check, which is every year at our anniversary time, 199 US off of our executive health checkup, which means it's 500 US. A lot of individuals have a wellness package within their insurance that typically is no less than 500 US. So you can use that wellness or you can pay out of pocket 500 US, but you're going to need to book that during May. And you can use it up until June 12th. You can make the appointment up until June 12th is what I recall. Let me just check to make sure.
Yes, that's correct.
12th, yes.
I can tell you that's correct.
My memory is still doing well, Dr. Naranjan. My hips are well, and my knees are well, and my memory is well. For right now, knock on wood. But we definitely look forward. Everybody's always excited. When is the anniversary special coming? So it's on right now before the end of May. And you'll be able to take an appointment up to June 12th.
And just a reminder that it's only available at the Camana Bay location. So that's important this time around.
Yes.
Go ahead and tell people how they can book their appointment.
So they can book it 640-4040 or info@healthcity.ky, or you can also go through our Connect app as well. So those three ways, one of those three ways, you'll be able to get through and take advantage of the special.
Fantastic. All right, folks, that's our Medical Rundown Tuesday segment with Health City Cayman Islands. We always appreciate them coming onto the program. Another very, very interesting discussion. Dr. Naranjan and the entire orthopedic team doing amazing work there at Health City. Are you actually doing any surgeries, Doc, at the Camana Bay location as well?
Yes, we have opened up surgery in Camana Bay location.
Okay.
Most of the times, the trauma patients and simple arthroscopic surgeries, we do it there. From the orthopedic point of view, I'm talking. But the robotic system is still in the East End. So most of the joint replacement we are doing in East End. But small daycare, minor procedures, fractures, any urgent care treatment, all of that, those surgeries can be done at Camana Bay. And the follow-up care, like if they do the surgery in East End, they can come for dressings in Camana Bay. They don't have to go all the way till East End like before. And they can do the follow-up consultations at Camana Bay.
All right, fantastic. All right, well, thank you so much. Again, folks, this is a wonderful opportunity to learn more about some of the orthopedic services, hip and pelvic procedures that are available at Health City, Cayman Islands. Shamari Scott, Chief Business Officer, Dr. Naranjan, Consultant Orthopedic and Joint Replacement Surgeon. Thank you so much, sir.
Thank you.
Thank you,
sir.
Sandy.
Yes, Miss Joanna says, amazing show, extremely informative. Celine says, Dr. Naranjan is not only a wonderful doctor, but also a very good photographer.
That's right.
Wow.
I was wondering why he didn't have one of his pictures behind him. But other question for Dr. Naranjan: have you beaten your daughter in chess yet?
No. I used to beat maybe 4 years back, not anymore.
Yes, and his daughter is on the national chess team, award-winning national chess team representing the Cayman Islands, and they're out there competing against the best in the world and coming back doing an amazing job. So congratulations on that front as well.
Thank you.
All right, guys, have a good day.
Yeah.
Bye, Sandy.
All righty. So thank you guys so much. I've been seeing all of your amazing messages coming in. Thanking me for, and I realized this morning I actually played an old intro for the show. I'll fix that, but it was actually nice hearing something different. I must tell you, we got to mix it up sometimes, I suppose. But yes, I wanted to say thank you guys so much for all of your messages. I feel like I was gone for a lot longer than just 2 days, because technically I only took off Thursday and Friday of last week, but you guys are acting like I was gone. I saw, who was it that said, yes, Channy says 5 days felt like 6 weeks without you. Oh my goodness. What are you guys going to do when I take my week off in August and then I take 2 weeks off in, the September? Oh my gosh. I don't know what you guys are going to do, but anyway, we're here. Thank you guys so much. So I did take a few days off. We had family visiting. And so I decided to go to Cayman Brac. Now, they were here and they were thinking about going to the Kimpton because, sometimes they come, they stay with us, and then they spend a few days at the Kimpton beachfront. They have a great time. And I said, what about Cayman Brac? Have you guys ever been to Cayman Brac? Because they've been coming here for years. And they said no. And I thought, what? You've never been to the Brac? Time that we did a Brac trip. Let's go, family. So we packed up some of our stuff and took a few days off and went to Cayman Brac. And I couldn't remember the last time I was in Cayman Brac. I was saying to Marlon, when did we come to the Cayman Brac last time? And he said, child, that was before COVID. I was like, what? COVID was like 5 years ago. Yeah, it's been a minute. So we had a good time. Drive around Cayman Brac. They were like, where are the cars? And I said, well, this is the beauty of life in Cayman Brac. Seniors are here. It's a wonderful opportunity to just relax out by the pool and the sand, wherever you want to relax. And let me tell you something. 2 observations I have to make about Cayman Brac. Number one, it's hot over there. It is hotter than Grand Cayman. I don't know why, but it's hotter. I feel like temperature is 10 degrees hotter than Grand Cayman. Woo, honey, child, I would get up and go outside early morning. I'm like, oh, I'm sweating bullets already. Yeah, and it's hot and dry. They don't seem to get a lot of rain. Like everything just looks so dry. I'm like, they have a lot of trees, but a lot of it is like cactus and, stuff that can survive in dry conditions. So I was very, very curious about how much rainfall they get compared to Grand Cayman, because they don't look like they're getting a lot over there at all. So very, very dry, very, very hot. And I got to, enjoy some time there. Of course, when you're in the Brac, everybody knows you're in the Brac. You just randomly run into people. Now, what I didn't know is that apparently it was Bacchanal weekend, but we got out of there earlier flight on Saturday. So Bacchanal, I think, started for 3:00. So we didn't get to see that at all. But I figured it was Bacchanal when we were trying to rent our car. And the guy was like, are you coming for Bacchanal? And we're like, no, is that this weekend? Yes, apparently it was that weekend. But anywho, I guess they had a good time. And I still can't believe, with the few little cars that I saw on the roadway, someone managed to have an accident on, I think it was Thursday night. How How are y'all running into light poles? Took out the entire light pole. Did y'all see that? Boy, we had some epic accidents this weekend. There was one on the not Linford Pearson, Esterly Tibbetts. 3 Honda Fits somehow managed to collide with each other, honey chill. What a hot mess. Y'all need to do better. Aisle 2025 said lots of drinking in the BRAC. Yes, they ain't got much else to do over there. I tell you what, you know, you can find some healthier things to do, but most of them, unfortunately, drinking a little bit too much. But yeah, it was great. We had a good time. Caught up with some people who now retired and lived over there. Our family, they were celebrating a couple really key things. They had a graduation celebration. Our cousin Maria finished her master's in nursing from University of Tampa. And she also, they were also celebrating their anniversary. It was their 16th wedding anniversary while they were here as well on Friday. And the funniest thing is they originally got married in Cayman. It's such an interesting story how our lives kind of interconnect and converge, right? So this is Marlon's cousin, Dr. Mark, and I guess Marlon would have heard about him, knew about him, but everybody kind of living their separate lives. Well, funny enough, back in 18, because Gigi was just about turning 2, we took a trip to Jamaica, a family trip, and they happened to just randomly have been there at the same time that we were there. So we did a few activities together, we connected, and we went to the zoo together, and that was Gigi, almost 2 years old, wanted to touch and play with the snakes. From then I was like, what is this child doing? No snakes, no, but she was into everything. And so we connected, and then we find out that they have a Cayman connection because Mark went to, what's the flight school called that's close to Stetson? Embry-Riddle, I think, University, whatever. So he's a pilot, ex-military. And so he went to that university. And then at the same time, there were a number of Caymanians, including Shamari, funny enough. There were a number of Caymanians who were going to Stetson University. And so they were in the same fraternity, like they knew each other, I guess, hung out, whatever. So he knows a few Caymanians. And he also got the two of them, him and his wife, got married in Cayman 16 years ago, way before we connected. And so it's just such an interesting story. And then when I found out that he actually lives in Tampa, I was like, oh, Tampa, that's my old stomping ground. So now we have someone else to visit in Tampa. So it's a lot of fun. And, they're I can't say young couple anymore, middle-aged couple like ourselves, I guess, really smart couple. They've got 2 lovely children, a 10-year-old and a 14-year-old. So we enjoy having them come to visit. And now we can, go visit them. We visited them last August in Tampa as well. So we're thinking we're going to do a family vacation together for this August also. So yeah, there you go. Family connecting kind of all over the world. And it's so amazing because Marlon has, cousins in Australia, the UK. He's got an aunt and a bunch of cousins over there, just all over. And it's nice to kind of keep those connections alive. And with the technology that we have now, it's so much easier to just call somebody in WhatsApp, to message somebody in WhatsApp. Hey, Auntie, how you doing? Just check in. So yes, thank you guys so much for all the amazing messages. CE Bank said we missed you. I appreciate that so much. But I wasn't really gone for long, I have to be honest with you. But I still, Abby says, welcome back, honey child. We missed you. I saw Miss Amelia causing trouble while I was gone, putting a all points bulletin out for me, wanting to know where I had went. And I was trying to keep it on the low key. I was like, I'm just taking a few days off. But we had a fantastic time. So yeah, the BRAC is a different vibe completely. And while I was there, it wasn't entirely all fun and no work. I did a few interviews, and you guys are going to find the interviews that I did very, very, very interesting. I tell you, like legit. So here's the thing. I did miss Miss Valda Scott. Whoa, 85 years old, acting like she's 65 years old. Very interesting. Got to eat some of her food. She's an amazing lady. And then listen to which one I did also. I did Foots. You guys know Foots, the guy who does all that interesting and some people think really creepy artwork and stuff. I got to talk to him for like an hour. Honey child, wait till we air that one. That's going to be an interesting segment. Brat Venture says, thank you for visiting. Well, thank you for having me. It was good. It was fun. And it reminded me of why I need to go to the BRAC more often. It's just a relaxing vibe. Even 2-3 days, your brain just like enjoys the break and you come back feeling refreshed. The other observation I made about the BRAC is, honey child, at night, 10 o'clock, I was in bed, ready to sleep. I'm like, good night. I went to bed earlier. I slept in the mornings. It just felt like I was tired because that heat was wearing me out. So yeah, I actually got more sleep and came in back, which probably is not a bad thing. And then I came back right back to my bad habits. I was up until almost 2 o'clock last night. Lord Jesus knows why. No, sir. All right. So on Wednesday, the RCIPs had their annual press conference. Good morning, Miss Sherry Ann, joining us from sweet Jamaica this morning, she says. We had the press conference, and I have got the entire entire press conference. So we're going to air that tomorrow morning on tomorrow's show. So let me just see here now. It was a very, very interesting press conference. We have a couple of shorts that I want to talk about. And then, of course, I want you guys to tune in tomorrow morning for the entire segment. There was a lot that was covered. And of course, I do want to thank the RCIPs for having these and for allowing us to, fully record it. This is one of the things that in the past, sometimes they're like, oh no, you can't live stream. I'm like, why? What I decided to do this time, instead of live streaming it, because I wanted to get the best quality possible, is I actually, went ahead and recorded it, and then we could do some shorts out of that and to kind of clean things up a little bit. So I was really, really pleased with the outcome of that. Like I said, tomorrow we'll air the entire thing. We have the statistics. We've done a few stories on what the trends are. So crime is up slightly, but the serious crime is down. So it was interesting. But I think that we have, let me just see if I can put my hands on some of the short reels here. We have a couple things that I know you guys are very, very anxious to talk about. The first one is in relation to the, we shouldn't call it a murder investigation. And I thank Miss Samantha, one of our listeners to the program, viewers on social media, for picking up on it, because they actually said they have not said yet that it's a murder. They have said it's a death investigation. So they are still investigating it. Cause of death is a matter for the coroner. But I think that most of us get a sense that this was a murder. Yes? Did we get the sense that this was a murder? I think so, yeah? It's unfortunate. People don't just randomly end up in a burnt out car. Now, I don't want to say too much, but what I do know is that there is quite a bit more to this case in terms of cause of death. But let's wait for the coroner's report to officially give those details, shall we? It's not good. It's a very weird case in a way, and the detectives are asking for help locating, vehicles. They're still combing through CCTV footage from different locations. For example, one of the things that they knew pretty early on, I think I can say this, is that she actually purchased the gasoline herself from a local gas station. She had a canister and she put gasoline in it. Now I'm thinking to myself, why would she be purchasing gasoline that ultimately is what caused her demise. It is a little bit weird. I just by putting on my amateur detective hat is, I'm thinking this was not done by her. This is somebody else. And maybe there was some kind of message or phone call to say, hey, we ran out of gas. Can you come and bring some gas for me? I'm sorry, but I ain't bringing no gas for nobody like that, honey child. Don't call me because I'm not doing that. No, honey child. You ran out of gas, call your mechanic. I can't help you. Oh my gosh, this gives me like what do we call it? EBGBs. It's just wild and crazy. That she actually stopped at a gas station, got the can of gas that ultimately perhaps partially ended her life. Now, I know a bit more from unofficial sources, but I don't want to say anything else at this stage. But I think suffice it to say is it was a horrific end, which is so unfortunate. She didn't deserve that. I don't care about any other details, what was going on. I don't care if this was an extramarital situation or whatever. I don't care. Nobody deserves to leave behind children, family members in that way, to die such a horrific way. So I think that's horrible. But here's what the police had to say about it, some questions that we had. Can I just ask in relation to that, have you detained anyone, even temporarily, questioning around this investigation?
We have spoken to a few persons of interest, and we have explored their accounts, and we have been able to, they are no longer persons of interest as it relates to this investigation. So for the Judy and Miles matter, this remains a high priority case. It's still active and ongoing. We have partnered with a lot of local and international forensic experts in order to get to the bottom of what exactly happened to Mrs. Miles. So we have engaged a forensic pathologist, a forensic anthropologist, and a forensic fire investigator. So what I can say is that from our initial forensic evidence, the fire was deliberately set. So we have that indication. However, we are unable to comment further on the investigation at this time as we are awaiting the final forensic reports. In terms of the investigation itself, we have been reviewing numerous CCTV cameras within the area. So far, we have retrieved CCTV from at least 29 locations, and we are actively reviewing those footages along with witness accounts, forensic evidence as we progress the investigations. So what we are asking the public, and I may just take this opportunity to ask the public for their assistance.
All right, so give me one quick second. I understand the audio, which is a little bit low on that, has caused the radio feed to go out. So let me just see if I can grab the radio back again. Give me 1 second here, folks. All right, folks, radio's back on. My apologies. This clip is a little bit low, and I'm thinking now when we play the one tomorrow, we're going to obviously have to boost the audio and that as well. But I have boosted it as much as I can here. So let me know, radio listeners. I'm just trying to see if I can potentially boost it any more. Do let me know kind of how it's sounding, and hopefully it will come in a little bit. I think all my volumes are boosted as high as they can go, but hopefully you can hear it and it won't shut off again. So again, this question was around the ongoing death investigation of Miss Judy Ann Miles, and police officer here is responding to it.
Assistance, we are particularly interested in any information related to a white sedan type motor car with a black hood or black dark colored bonnet that may have been in and around the Lookout Gardens area on the afternoon of April 3rd. So we thank the public for their support and cooperation so far, and it would be really, really helpful if we could get some information around that vehicle.
Can you confirm if this is a murder investigation?
So a formal classification of the investigation will be determined once we have the forensic findings, including the outstanding toxicology and trauma assessments that are ongoing.
So you're still looking at a cause of death at this point from the forensic evidence?
Well, cause of death would be a matter for the coroner to decide and speak to the public about, but in terms of hypotheses or theories that we're investigating, it's still an open investigation, and we're looking at all investigative avenues.
Okay, thank you for that.
All right, thank you so much. So again, it's a death investigation. They're waiting on the official reports to determine cause of death. But they are asking for the public's assistance. If you're able to assist them in any way, please, by all means, come forward. And they're looking for a particular vehicle. And they mentioned also that they are still combing through footage at this stage, CCTV footage. They've got quite a bit of that they've collected from the surrounding area. And I'm really, really hopeful that that will net them some useful information that they can, then put to good use. So, wow, it's just so crazy. I am just like blown away. Unbelievable. The concept of what we call femicide in the region in particular is very, very high. It's something where, women are targeted mostly because they're women. And it's quite unfortunate that that is the case. But women are at high risk in most places in the world. Women are at high risk of being murdered, normally by someone that they know. That's sort of the starting point, if you will, for a lot of these things. So someone knows something. This is never the case where nobody knows anything. And if you know anything that can assist the police in their investigations, I would encourage you to please reach out to the authorities, even if you have to do so anonymously, and give them whatever information you have available to you that could possibly help their investigations. So John LaRue says, who's the guy with the sunburn / high blood pressure? Oh my God. John LaRue, you did not just go there. No, you didn't. No, you did not. John, try to behave yourself. That is, hold on. Let me get the proper title here now. Let me see. Oh gosh, what's his name again? Landon? Hold on. Let me get you his full title. You guys might have remembered that once I had to tell off a particular officer in the force, senior, and it's him. So, let me see if I can get his name. Can't remember now. Hold on. Where's that RCIPS story? Give me 1 second. His name is Detective Superintendent Pete Lansden from the UK. Peter Lansden, yes. Oh, I think we got a little typo in this caption name. All right, I'll have that fixed. But yes, that's his name. How can I say this? Let me say this in the most English way possible. Interesting chap. Interesting chap. Yeah. Okay. But yes, he's there at most of these press conferences. Paul says, I was thinking the same thing, John. All right. V the Money man says femicide is quite rampant in the region, especially in the Hispanic countries. Well, yes, Hispanic countries and just around the Caribbean in general. Unfortunately, Cayman included in that. You are more likely to be a victim if you're a woman. We saw just this week, it was reported that, and femicide, for those of you who don't know, is the killing of a woman or girl, in particular by a man, on account of her gender. So there were 2 women this past week that were killed, one in Colombia and one in Mexico, both, influencers. The young Mexican young lady, she's only 23 years old, Valerie Marquez, and they're treating that as a femicide. And prosecutors have said, that she was killed because she's a female influencer. And unfortunately, days after that, like literally the next day, another young lady who's Colombian, and she's a social media influencer as well, very beautiful young ladies, she was also killed. Quite shocking. They think that the one in Mexico, lots of rumors around it. She was shot dead at a place called the Blossom, the Beauty Lounge, which is a beauty salon owned by the victim in Zapopan, which is a town in the central eastern state of Jalisco. And apparently they're investigating the crime as a femicide. So they believe that it was motivated by the fact that she's actually a woman. And this happens a lot around certain cultures. And, it could be cartel related. And, I guess we'll have to wait to see if anything comes out of it. Unfortunately, a lot of people are killed in these countries and nothing ever happens around it. She began to make a name for herself in 2021 after winning one of their local beauty pageants. And shortly after, she started to create social media content where she would share makeup tips and personal care routines, talk about fashion, and show off her travels. Photos of her in a private jet and yachts can be seen on her Instagram account, where she has over 223,000 followers. And that was just on Instagram. She had another 100,000 followers on TikTok. So it's unusual. She said, during the live, she was waiting on a courier she knew to deliver a gift. It was weird because she actually said that her friend, she said she was a bit worried because her friend could not see the courier's face when he arrived. And I guess they let him in to the shop thinking that, he was coming in to drop it off. And listen to how ironic this is. This is what she said during the live. She says, why didn't he just drop it off, the gift? Were they going to pick me up or kidnap me or what? She wondered aloud to her followers. And while holding a pink stuffed animal, she looked away from the camera and immediately grabbed her chest and belly before collapsing into her chair. So they shot and killed her on the live stream. Oh my God. Just shocking. They say that at least 2 men and motorcycles arrived at the salon, and one of them asked the victim if she was Valeria. When she replied, yes, he pulled out a gun and shot her at least twice before fleeing. So they're checking CCTV footage, of course, now to see if they can figure out, who is responsible for that one. And then just days later in Colombia, it was another unfortunate circumstance where another woman was killed as well. Pretty crazy. And that was a Colombian social media influencer also. Pretty wild. So that was 2 social media influencers killed days apart in very similar attacks from Latin American influencers. And, the Colombian, she was a model and social media influencer, and she was also shot dead by a delivery man. So very, very similar, just days after the Mexican TikToker was fatally shot during a live stream. So this is something that is picking up news all over the world. And like I said, these young ladies, absolutely beautiful young ladies, when you see them, you would think, oh my gosh, surely, they were doing their own thing, and who on earth would do such a thing? Quite sad. So femicide, folks, not entirely unique to Cayman. It's a regional issue, both here and obviously in a lot of Hispanic countries as well. But even in the United States of America, you're more likely, unfortunately, to be killed just because you are a woman. So sad. All right. Very, very sad for those communities and those families. So thank you so much. V the Money says also 3 women got killed in Roatan and 3 Americans in Belize. All women? Oh. So sad. Now, speaking of violence against women, I guess a lot of you would have seen the situation in Jamaica with the businessman basically dragging and stomping on the nurse. I think did they have a protest yesterday about this? I think nurses around Jamaica were having a protest. I understand something was planned. What a shocking video. OMG. Talk about violence against women. Oh my God, this dude just dragged her, stomped on her, kicking her. I mean, I was shocked at the level of violence against this woman. And she's a nurse. And then he pulls out a gun and all this sort of stuff. Well, the Jamaican authorities wasted no time. Cayman could pay a little bit of attention here. Jamaican authorities wasted no time dealing with this situation and ensuring that he was not just arrested, but charged. And in fact, they issued a statement. Let me read the statement that they issued, because there was such a public outcry, and it certainly made me reflect on how, interesting, for us, we have a road rage situation, and I'm going to talk about where that is still being investigated. Well, technically they've concluded their investigation and they've sent the file over to the legal department for a ruling. Now we have to wait months for them to decide. But let me tell you something. The Jamaican authorities did not play around. Issued an immediate press release from their constabulary force on May the 15th. And they have said that businessman slapped with assault charge. I love their title in their press release, honey child, following assault of a nurse in St. Andrew. So they say that they've charged he's 65? Oh God, he's got too much energy for a 65-year-old to be beating on a woman. Lord Jesus, what a mess. It says here that sleuths assigned, who writes their press releases? Gotta love them. Assigned to the St. Andrew North Policing Division have charged 65-year-old businessman Robert Bell, otherwise called Andy Bell, of, is that Grosvenor Terrace Street? St. Andrew, with assault occasioning actual bodily harm following the assault of a nurse along Mount Friendship Road in the parish on Tuesday, May the 13th. So literally 2 days later, they confirmed that he had been charged. And I think it's actually a number of offenses in addition to this. But reports, it says, are that around 7:15 p.m., Bell was the driver of a Mercedes-Benz motor vehicle ahead of a woman's Toyota Vitz motor car, abruptly halted and started swerving along the roadway. The woman allegedly attempted to drive around Bell's vehicle when she was stopped, got out, shoved his head into the woman's vehicle, spat in her face. Boy, this is bring back some memories from Linda and Larry and Linda. Spat in his face and struck the vehicle repeatedly with his hand. The woman exited her vehicle to make checks for damages when she saw Bell with a handgun in his hands, and he then flung her to the ground and physically assaulted her, causing swelling and bruises all over her body. A report was made to the police, and Bell was subsequently apprehended and taken into custody, where he was formally charged. His court date is being finalized. Oh my God. What on earth? What? Who put something in his Milo that night? I don't know. But I tell you what, Jamaicans not gonna take it so lightly. They actually understand. I haven't seen it, but somebody was telling me that they actually sent out like a press thing, like all the nurses have gotten together and they have sent out something saying, this is him, this is where he lives. Here's a picture of him. And, all nurses remember him. 65 years old. I feel sorry for him if he ever needs to go to the hospital in Jamaica, because them nurses are going to be like, honey child, we are not going to be helping you. I'm trying to get the video because some of you might not have seen it yet, but it was disturbing. Very, very disturbing. Oh my God. Unbelievable. Let me see if I can find it. But yeah, I mean, just a shocking assault. Like, why? It's hard to fathom why someone would find all of that necessary. It's like, dude, what is wrong with you? Now, when you see something like that, it's got to be a situation where this man has no doubt done this before. This isn't normal. Listen, we all have a moment where we see somebody in traffic and you're like, you'll give them the finger or whatever because, they're really getting on your nerves, right? That's one thing. This was absolutely next level. He even had his shirt off. What was he doing with his shirt off? Listen, some of y'all are just women beaters, and we need to accept you for what you are. He probably has been doing this all his life to women, and no one ever reported him because, he's a businessman, so they think he's somebody special, I guess. Really, really disgusting behavior. And to do it, a nurse in uniform, no regard even for her as a professional, really is just absolutely sickening and disgusting. So let me just show you guys the video. I think I have to mute it because I didn't personally listen to the audio, but it probably has some profanity in it. So let me just mute it out of precaution. So here we see he has no shirt on. He actually has his foot on her, pushing her face into the ground. He puts his foot, he has his gun out. Now he actually puts his foot and his weight on her head. Look, he actually walks on her head. Oh my Lord, with his dirty shoes. And you see these other people, it looks like a guy there was trying to help her, but he is just flinging her around. I guess that's when his shirt came off, was during this part of the fight. Oh, just wild. Wild. Look at how you just saw how he like body slammed her. You can kind of see behind the car. Thank God someone was in another vehicle. I guess they weren't going to get out and help nobody. But child, they were sitting there recording it. You can see when they kind of put the camera down, the mister got a little bit scared. He probably was going to shoot at him or something. Folks, this is more reason why everyone, and I do mean everyone, should have a dash cam on their vehicles. By the way, we asked that question of the RCIPs. A lot of you were surprised to hear that they don't have dash cams, they don't have body cams, but they're working on it. They said soon come. But look, I mean, look at how he manhandled this woman. Whoa. Wow. You can't, oh my God, you cannot be careful enough on these roadways. Somebody else said that he's done it before. Woman says she was the victim of the same guy in a road rage video. Oh, really? I could tell y'all, I'm not surprised, you know? This is not the kind of thing. Any profanity in this video? Let me see. Someone says camera or camera and a gun. Well, in Cayman, you're only legally allowed to have a camera, no gun. Okay. So let's see what this person has to say about him.
Go right, he swerved right. I tried to go left, he swerved left. That went on for about 3 different attempts to go around him. Eventually, I went around him on the other side of the road to get away from him. I drove, and when I got to Stella Maris, I realized it was still behind me. I called 119 at the time. 119 was on the phone with me, and I got into Grant's Pen where we had a red light. The man came out of his vehicle with a gun in his hand and a hot coffee cup. And he used that hot coffee mug and beat down my window. The man beat that window down. The police was still on the phone, on the Bluetooth, so he could hear what was going on. The recount I'm giving you sounds eerily similar. The light went green, and I went onto Upper Waterloo where there was a patrol car on the side of the road, and I pulled in behind the patrol car, and he sped around. The policeman on the phone said to me, drive him down and get his license plate. Well, at that point, sir, I was so traumatized. I said, no, sir, because I value my life more than his license number. And I called Crime Stop myself a few days later, and I had nothing to give, okay? But the person said to me, they will return to that same area. They will return to that same area. And, sir, it is so similar. It is so similar. A white, one of those, and the Benz is souped up. You know, when Jamaicans said a car soup up, it was a muffler that made a lot of noise as he was swinging from lane to lane to lane. And he had a gun in his left hand and his hot coffee mug in his right hand.
People, I don't have nothing to say. You guys be the judge. Anything you want to say in the comment section?
My God. What a mess. No, sir. Someone said this is the first part of the video. All right, let me see. Let me see if we can play this. But wow. So yes, I'm not surprised. I am not surprised. You know, people don't have that kind of anger like what you saw displayed as sort of a regular occurrence. That ain't normal. Woo. Someone said that you know, he better be careful because Jamaica is a country that's not gonna play around with him, going around now doing this to innocent people. Have a look at Oh my God. All right, let's fast forward.
As investigation continues.
Let's see here. We got a little report coming in.
Both drivers on the Mount Erie main road in St. Andrew on Tuesday night. The incident happened around 7 p.m. Residents of the usual quiet farming district have been left questioning the roadside Mali. It is understood that both players are known to the community. Amateur videos of the incident have since gone viral on social media. A senior police officer confirmed the incident and said the man remains in custody as investigation continues. People, you see that? You see how the man rising foot a while ago? What do you think him put in foot when he done? Right in a nurse head. And him turn up in a nurse head and then he come off. The man put the whole line pressure in a nurse head in a people. Me hear say this man is a businessman, and me I hear say this man is a security guard. But
What?
whether businessman or security guard, right now he is
Security
in police
guard.
custody. And me get to understand say him down a station a ball. Him down the a ball. Right? The businessman part of it, them say a blocking a road. The woman I go about her business. Him in front of a woman, the woman a blow him to come out of the way. Him now come out, then him stop, block the road, come out of the vehicle with him gun, take out the woman out of her car, drag her out, and start beat her with him gun in her hand in the people. And watch her now. In a video, you have about 20 man. And this some me I put it, because me I make it look extra now. About 20 man did it. And the boy we a beat the woman, the monster or the gorilla where you want call him, we a beat the woman. You know say, in gun drop. And somebody take up in gun and give him back, you know. You can imagine one man a beat up one woman in front of uno as man. And uno not do nothing at all. See? And the man gun drop. And you take up it and give him back. You see right there, so? After you give him back the gun, you know. If you need to shoot the woman, remember say you responsible for that. Because if me see a man a galang so in this rage yeah, with one woman and for him gun job, me a take time kick away. See? Or me take up it too. Because me a go feel some type of way if you know say one man I deal with one nurse or one woman so in front of me and know say watch ya, the woman not doing nothing. People don't talk about say this man have gun in his hand, so the man them where they run him can't do nothing. Enough time, me see people attack police with them gun. More than one police. And more than one man did it. So more than one man could a man handle the man with him gun, take a gun from him, fling him away, because he drop already too. So when you give him back far, and stand up there and watch him man tap up in a nurse head. And all you know say, easy no, this, that, no try to restrain this man, I try to lick out in teeth or something. Eh? You know tell me say, because he have one gun in his hand, you afraid?
Yeah.
But if I did police now, you quarrel him, and talk this and talk that and go with a bag of things. And look what Jamaica witness. And last night or this morning, because the video gone viral. People, as me say, me hear say him is a security guard, and one I knew say him is a businessman. I don't know which one him be, but them say the businessman he own one tours. He might come from one bar, they say people, and he must be drunk. And the woman they behind him vehicle because him in a middle road with him drunk himself, and the woman a blow him kick. So it seems as if he was annoyed by the blowing of the horn. And he come out and car now, stop in the middle road, come out, block the woman road, and drag out the woman, the nurse, out her car. Every nurse in a Jamaica fi strike right now. No do no more work until this man go down. Because if he come down today, and if he losing gun license, him not have no more gun license. Because it seems as if say, at the gun, make him feel like saying so powerful. You can imagine, one man a do one woman that people. The man flinging woman all boat in a man. Jump her boof out the woman a ball in a. The man a tapping that woman head in a. Feel what? Me want know feel what? Me don't know you know. Me don't know. But if me a police and see all this video here, when me go, and me want to go arrest him. Yes, I want to go and arrest him so quick and fast when we find out which party he is. And you see when me go find people, me I deal with him neatly. And now make him feel like nothing wrong. When he do wrong, you know, so he know say that's why we come for him. But me I neat him up once he is arrested and bring him guys station. When you see when me bring him guys station, Jesus have mercy, my God. Everything when him do to a woman, me I do him back. Because me as a police officer, I'm full of power now. So everything when you do to that woman, I as a police officer would have done back the exact thing to use her. And this time, would have turn up in your head with me 2 foot. Here. Because you, sir, why you do that to the lady? Why? And God earth, why you do that? Tell me now. If you have a wife, your wife will pack up and leave and file divorce. And your kids them to move out and go somewhere else go live. You're a dirty man. You know, you see you? You're very wicked. I mean, no say.
Oh my God.
The first woman you do it to.
That's true.
You do it to other women already.
Yep.
And I first.
Yeah, I agree. El Rey says the cameraman's job is to video, not intervene. Otherwise, there'd be no evidence. Well, I tell you what, I'm glad that there's evidence, but surely, normally Jamaican streets are very, very busy. And to this gentleman's point here, I don't know exactly who he is, but to his point, come on now, there were other vehicles there, other people who would have been watching this. They could have attempted to intervene. I get it that people are scared if they see a gun, if they see a weapon. But he says, listen, in Jamaica, they're used to, they're used to people having guns all the time. And there are times when if they see the police doing wrong, they're going to go up to the police, and the police have big guns, and they're going to still protest and whatever. So I think it is interesting. And we've seen this before, where sometimes people, and there could be, let's give some of the onlookers some degree of, up to a certain point, you give them a little bit of like, okay, maybe they didn't know what was going on. Maybe they didn't have all the information. But at this particular junction, it's like, come on, you see him flinging this woman around. Maybe people thought this was a personal relationship. It doesn't matter. It doesn't matter if this was his woman, his girlfriend, whatever. This is not the type of behavior that he should be engaging in at all, much less on a public roadway. So it is concerning that a lot of times, especially when it comes to violence against women, other people, other men will stand by and they hesitate. They hesitate before getting involved. And a lot of times, they don't always hesitate when it's another man or when it's their friends and that sort of thing. So yeah, it is very, very concerning. Now, here's what the nurses had to say about this as well, because this obviously was trending. Jim, good morning. Jim says, sorry, Sandy, I cannot watch this type of behavior. It makes me so damn angry and disgusted thinking a male, no man would handle a woman like this again. No man. Let him size up to man his size and see what happens to him. Nurses, of course, completely outraged by this. Have a look.
With Mrs. Dawn Marie Richards, the president of the Nurses Association of Jamaica. Mrs. Richards, can you tell us what is happening today?
Today we are having a sensitization in relation to violence against women and children.
Have you spoken to Nurse Facey?
No, I have not.
But what is the sentiment across the Nurses Association at this time with what has happened to Nurse Facey?
What is the sentiment? The sentiment is one of disgust, one of annoyance, one of anxiety. As I was saying earlier, the Nurses Association of Jamaica since 2015 have hosted what we call an Orange Day Walk, which is an international event held on the 25th of February every year. By right, we should be doing the sensitization at least once per month, which would be on the 25th. And there's a significance to that internationally. But we will continue to make our voices heard. For us at NAJ, our last sensitization was done in Black River, where we went out in purple to sensitize persons as to the importance of knowing and reporting and talking about gender-based violence.
So is this just in relation to what has happened to Nurse Facey, or is this in relation to...
No, it is a culmination of a lot of things that have been happening. Because when this incident was happening to Nurse Facey, ironically, we were discussing the incident of the young girl that was found in the barrel and the student from UTEC who was missing, who at this time we would have learned, unfortunately, of her demise. So it's something that we always are aware of, and this is not the first incident of abuse publicly against a nurse. A couple years ago, one of our nurses was killed by her partner.
What would you want to say to Mr. Bell today?
I don't know if I have anything to say to Mr. Bell, to be honest, Andre. At this time, I am that angry. I don't know if I have anything to say to Mr. Bell, because I want to say, at the end of the day, a man is innocent until proven guilty. But all I want to say, I am happy that somebody caught all this activity on video. Because I believe that if this wasn't caught on video, the nurse would not have had a case.
So you're standing in solidarity with Nurse Facey, and you and your colleagues will be doing all that you can to give her...
continue the awareness and to do anything we can to help our nurse. Nurse Facey is a member of the Jamaica Enrolled Nurses Association, and this is her president. So these are the persons we are standing with. Nurse Banbury Edwards is president of the Jamaica Midwives Association.
Oh, so this is the conglomerate of nurses. So this is the nurses enrollment, and this is the midwives.
Yes.
Do you want to say anything to Mr. Bell today?
Man up, stop acting like a coward, love children, love women. Only a coward carry out an act like that.
Only a
Prey
coward.
on the females of our society. Only a coward, that's a cowardly act. And we're asking all the persons out there who have done or who have the intention to, no more will be tolerated. Love with children, love the women. Children need love and attention. Women need respect and affection.
Midwife?
I totally stand in solidarity with the other presidents here. Definitely, as a midwife, we work with women and children very closely. And when I saw this act, it just shows that this man is a weakling.
Yes.
You know, weak, very weak. You know, and we are really outraged and we are saddened by this action. And we are here today standing in solidarity with all our members.
All right, thank you. Have you been able to speak to Nurse Facey?
Yes, and it is not easy. She's a part of us, and what she's going through now, it is not easy for any one person to go through. The physical pain, the emotional pain, the flashback and all, it is not easy.
So the psychological trauma is a lot?
It's a lot. It is a lot for any one person to be going through right now.
What is her physical state like?
She's having a lot of pain, and just imagine somebody weighing 130 pounds, and you have somebody actually weighing 200 and something pounds, lifting that person, slamming the person to the ground like a rag doll.
We'll keep her in our prayers, all right?
Thank you.
God bless you.
Wow. Absolutely shocking. And of course, we stand in solidarity with all victims across the world, but definitely, right there in Jamaica. So shocking. And I see some of your comments. Just absolutely shocking. Rodnick says, I am so disappointed that nobody stood up for that woman. I think that one guy was trying to kind of towards the end. Anthony says, boy, these Jamaican hosts are very animated when telling stories. Yes, well, Denny says no police officer has the power to abuse a person in their custody. Well, yes, okay. Well, they do it. They're not supposed to do it, but they do it. So this might be one instance when we'd be willing to look the other way. Denny says no one should be hesitating to defend a person who's being attacked like that. Ms. Brenda says men that beat women would never stand up to man. They're cowards. That's why they can only beat a woman. It's a sickness. Read up on it. Yeah, definitely cowards for sure, Miss Brenda. Jim says, we call guys like this a punk ass bitch boy. Oh, Lord. Joanna says all women stand in solidarity with her nurse. Absolutely. Miss Brenda agreeing with Jim. V the Money says we need to protest like this in Cayman, right? Listen, I tell you what, Jamaica, they wasn't playing around, and she put it, that last nurse really put it in proper context when she talks about the size of this victim in comparison to him being flung around like that. Oh my God, absolutely horrific. I cannot imagine what got into him. But like I said, this seems like something that he has probably done before. And, now she's physically bruised and battered, and she's also having the psychological impact of that as well. Yes, sir. I'm still on air, but I'm gonna send somebody for that plate right now. Sounds like I heard the doorbell.
Yeah, I just rang the doorbell.
Okay. All right. No problem. Thanks, dear.
All right, no problem.
All right. Let me see here now. Let me see. Miss Stacy, I got some turtle meat at the front door. My dear, let me tell you all about I can tell you about my turtle meat here in a second. Ooh, I had some nice turtle meat yesterday, boy. Had to go for seconds today. Miss Lucille says, Sandy, watching about the nurses making my stomach sick. Jim says, make voices heard. Yes, I mean, this is a horrendous situation, and I'm glad that people are showing that they are standing with this victim, and justice has to be served in this case. The police have responded. Like I said, they wasted no time, thank God, because I think they knew the people of Jamaica would have been protesting this situation. But let me just show you guys really quickly. Let me just get this video. Let me see here now. The police wasted zero time, folks, in responding to this. Oh, this one won't download from the police. But anyway, the constabulary force there in Jamaica responded immediately and arrested him and then charged him within just a couple days. So we were glad to see such a quick response from the authorities. And I'll be quite honest with you, I think that this is St. Andrew North Police, I think that we know that they're probably doing him a favor, right? By dealing with this quickly is probably saving his life. Because this man is a marked man now, walking around any part of Jamaica. You know them people like, listen, Bobo, we're going to deal with you. We're going to give you some of them licks that you were giving that woman. Here's what.
To the video that is in the public space of a nurse being assaulted, I want to assure members of the public that the matter is being dealt with and due process will follow. The accused, Mr. Robert Bell, otherwise called Andy Bell, a businessman of a St. Andrew address, was today charged with the following offences: assault occasion actual bodily harm, assault with intent to cause grievous bodily harm, assault at common law, possessing a firearm with intent to commit a first scheduled offense, possession of firearm with intent to cause injury. His court date is pending. These offenses were committed on Tuesday, May 13, 2025, about 7:15 p.m. along the Mount Friendship Road in the parish of St. Andrew, while the complainant was on way to work. The now accused was arrested the following day and was charged after a question and answer interview was conducted with him in the presence of his attorney. On Friday, May 16, 2025, the commanding officer, the crime officer, and other members of the St. Andrew North Division met with the complainant, her family, and members of the community, and they were updated on the progress of the investigation. I want to use this medium to thank the public for all the support and concern expressed, and also to encourage all the persons who witnessed this incident to come forward and let all the truth be heard.
Wow. All right. So definitely the authorities on top of it there. Damien says this is why women should not be on the front line when in the military or in war. Huh? Okay, Damien, you're kind of losing me here. When you're in the front line and you're in war, you have the necessary tools and training to defend yourself. What does that have to do with you having a road rage incident and pulling over a nurse on the side of the street? I'm not quite sure that I'm following your logic, Damien. So, yeah, okay. I mean, not all women are weaker than men. There are a lot of women who have trained and can defend themselves and so on. But in this situation, what the woman say? She's 130 pounds. He looks like he is well above that. And she would not have been prepared for this type of violence against her, as no woman really just driving, minding their own business, trying to get to work. That's crazy. That's absolutely crazy. The biggest issue really is how men in particular see women, and that is that's a huge problem. All right, this one says Damien is conflating issues. I served with a female sergeant nicknamed Xena for her proficiency in combat. You didn't mess with her. Exactly, but women in those situations are well equipped to handle themselves for the most part. You're in a combat situation. just driving on the street, the average woman is not expecting a man to drag her out of her car and beat the shit out of her. There's no correlation there, I don't think, between the two. Gabby says women need easier access to have pepper spray, stun guns, etc. V the Money says he's going to be dealt with in jail. Then prisoners hate abusers, women beaters, rapists, child killers with a passion. Joanna says, I agree that he should be sent straight to prison. V the Money says Damien is probably conservative. Woo. Gabby says, see this? Why men like that is why they're single. Damien says, no, it's just being a woman. They should be protected and not put in those situations. It's not really the same thing when you're in combat. You've like signed up for it. And you've, like I said, had the requisite training. You know, there's a lot of women that he would not have been able to do that to. Our dear young Cayman, Denise, good morning, Caymanian, suffered the same fate with his aggressors. Where? Quick time, Jamaica, pick up the man. What's happening here? Well, let's talk about it because I had to ask the question at Wednesday's press conference, and this was the response. One final traffic. Linda and Larry. Can we get Linda and Larry. Has any additional person been arrested and or charged in relation to that road rage incident?
So I'm pleased to say that the investigation was completed a couple of weeks back, and it's now sat with the Office of Director of Public Prosecution. So we're just awaiting the result from that. There's nothing much more I can say at this point. But we've done it as what I stated at the time. We need to do a thorough investigation. That's now been submitted.
All right, so they've completed their thorough investigation, and it has been submitted to the DPP's office. What I would say is, again, the contrast of that versus how the Jamaican authorities responded, very, very stark contrast. There's one.
To the video that is in the public space of a nurse being assaulted.
And this is the divisional
members of the public. That the
crime officer. And this, keep in mind, this is days after the incident. This now from our police is months after. Very, very different response. I don't know what to say, except that it's obviously day and night, and it's taken so long. It didn't take the Jamaican authorities a day to complete their investigation, and they arrested and charged him. Good morning, caller.
Good morning, honey child.
Good morning. I'm back.
Yes, not long, unnecessary.
It was only 2 days, you know.
You had Thursday, Friday, and Monday. You could have rested Saturday, Sunday, Monday, and start depriving the people of Thursday and Friday. You just the worst. You gotta do.
Ay.
Gotta love you still. Though.
Thank you, darling.
And welcome back.
Thank you.
My darling, we're on this note again.
Uh-huh.
How are we going to fix it? I don't know.
Oh, God.
Because, my darling child, let me tell you something. You cannot be a part of the problem or the solution if you yourself is a part of the problem. Mm-hmm. And the part of the problem with our law enforcement is the police. Mm-hmm. The police is the problem. Look, as you said, how quick we got results. Or results was given for that nurse. Mm-hmm. Why can't we have proactive police like that here in the Cayman Islands? Mm-hmm. And you know what is so sad? Our Commissioner Kirk Walton, he is aware of everything that is being done here. He is knowledgeable of it all. He's been in the force long enough to know how they operate, how they speak, how they think, how they move, and yet, now that he has become commissioner, you see any changes? Has you seen anything change? Any behavior change? Any accountability change? Anything?
Mm-hmm.
Nothing. When people hear me say the Cayman Islands is in trouble, we are in serious trouble. Unless we get someone with backbone to carry out accountability. And it also goes for our court system too. Because let me tell you something. When you find a law enforcement officer breaking the law, oh my God, they should get a double dose of the penalty. You understand? Look at the officer a couple of weeks back, community service, fighting at a bar and creating an accident and leaving the scene of an accident. And all that officer got was community service. Now you gonna tell me something not wrong with the system?
Yeah.
Something is about
For sure.
the law.
Yep. No, I totally agree. Yes.
No, it needs and it come in like our governor, like she don't care either, because we had a meeting with her regarding the police, and we asked her to bring in the commissioner, bring in whoever she needs to bring in. So let's sit and confront them. Let's have a meeting and let them know that this isn't working. This is not good for the island. And that been about 2 years ago, and after this blessed minute, she has not even had the manners to answer back. Miss Welcome, we're still working on your meeting or anything. Nothing. So the whole system is corrupt. The whole system is broken.
Wow.
And it needs to be fixed. We cannot continue like this. You got crimes happening after crime, and people are not coming forward. You can plead till your face turn blue. People are not coming forward because they know the tactics. They know that their names will be called and say, well, Miss Welcome made this report on you. Miss Welcome is the one who called us. And that brings problems for Miss Welcome. That can bring animosity. That can bring even death. And they don't see it that way. I mean, just when Monday this happened to me on the beach. It happened to me on the beach. I seen these young boys from Winter Park up inside the bathroom distributing drugs. The police was called, and after the policeman talked to the young man, and I called the officer and was speaking to the officer. After the officer left, oh my gosh, the young man came to me and said that the police told him that I called the police on them that they were in the bathroom. I said, the police can't tell you no such thing. The police can't tell you no such thing. The young man said, yes, man, the police told her.
Wow.
The police plainly told me that it was you who called her.
Oh my God.
You understand? And what is so ironic, the police went to them, and the young man walked away from the drugs and went in another location and talked to the police. And that incompetent officer couldn't see that diversion and jumped in his car and drove off. And when you hear me say that we got some serious incompetent officers on our force, we have them, you know?
Yes.
I mean, what happened to the police them in the 80s, the 90s? They were quality police officers.
Yes.
But what we have right now is quantity, not quality. There's a humongous difference between quality and quantity. And it's sad, because in these are the Maroons, God forgive me for calling them so, but that we have running up and down in our police cars and claiming to be officers of the law, when it's them same one who are breaking the law. And don't care to do anything of what they're hired to do, what the people of this country, these 3 islands is paying them to do, because it's the people first. And then the commissioner has the audacity to want to go back for a bigger budget. For what? What have he accomplished? Look at our communities. Look at the drugs day and night that are being sold at specific locations in our communities. And then the thing is, the officers know exactly where and where. The only time you would find them doing raids or ticketing illegal parking is when it's time for a meeting or they have some what you call it, in conference. When they have some conference that they can boast and brag and say, well, we did this and we did that, like macho. And after the conference or the meeting, everything going back to normal. That is baloney.
All right, caller. Thank you very much. We have to have another caller. I appreciate it, my dear. All right, caller. Good morning.
Good morning, Sandra.
Good morning, dear. Not bad. How are you?
All right.
Good.
I have trouble understanding how Cayman back is harder than Grand Cayman.
I don't know, but it is.
I think you might have just been spending a little bit more time outside than you regularly do down here in Grand Cayman.
I guess that's true too, but it just felt hotter outside. But you know what? I think overall, because even when I came back to Grand Cayman, I think the temperature over the last couple, maybe the last week or so, you feel summer coming with a vengeance. So it could just be that we're coming into the summer months now, right?
Well,
so you kind of feel it.
Me.
Yeah.
I don't know it all too well. Sandra?
Yes, sir.
Look, I just heard I heard Miss Ramírez's words and the conversation and the way it's going. There's a fact which Cayman needs to just recognize. Whether or not Cayman addresses it, Cayman needs to recognize this reality. The Cayman Islands Police Force, all the way up to the judiciary and beyond, by what is called, at least in my terminology, a construct of contract, is designed, implemented, and enforced for the well-being of the Crown, above and beyond the well-being of the Cayman Islands and her people. The Royal Cayman Islands Police Service is not accountable to, beholden to, the people of the Cayman Islands. They are accountable to the governor. And there is a divide there which exists. And that reality needs to be understood and recognized by everybody here in the Cayman Islands. If Cayman wants to change that equation, then Cayman will have to buck up, grow up, and evolve. But this is not going to change in the immediacy or the medium-term future because of that equation itself. I have a lot of respect for Mr. Walton, but Mr. Walton is working within that system. And that system that we have here is the only thing that he has to work with. He might be the chief of police, but he is dealing with parameters and hindrances which are going to stop him from making steps which he himself may want to make to improve law enforcement here in the Cayman Islands. I'm not going to say that Cayman is a war zone. However, we do have to understand this. If you have a force of people, who have exemplary powers within a given society, and that group of people, that force, is not beholden to and accountable to the people of that place, that is not a service. That is a presence.
Yes.
So if we came on really want to have a police service a police force that we can demand accountability of, then we will ultimately have to change the construct of contract which we have here in the Cayman Islands as it pertains to our relationship with the Crown. Because as it stands today, we can complain from now into perpetuity to Madam Governor or anyone who will replace her. But that is all we can do. There's nothing else which we can do. And Madam Governor is not beholden to the well-being and the interests of the Cayman Islands to the exclusion of any and all others. Madam Governor is responsible to the well-being and the interests of the Crown. And those two interests often do not align with each other. That is why what we see here in Cayman is a whole lot of hollow rhetoric and a whole lot of keeping up of appearances. That's one thing I would suggest. We have to recognize if Cayman chooses not to address it, that's a whole nother thing. But please, let us simply recognize this reality for what it is and quit acting as if that reality does not exist. Because our members of parliament have one singular control when it comes to the entirety of the judicial system here in the Cayman Islands. And that is to hand over millions and millions and millions of dollars annually That is the only input. Unless you're going to talk about some very untoward and undue and illegitimate influence on the part of members of parliament in an under-the-table relationship with certain police officers.
All right, we've got another caller. Thank you, Jonathan. Thank you, I appreciate it. Good morning, caller. Welcome to the program.
Good morning.
Morning, Miss Brenda. How are you?
And where were you gallivanting off for all those days?
It was only 2 days. I just came and back.
Inquiring minds want to know.
And came and back for 2 days. 2 days.
Okay.
Yes, ma'am.
A real vacation.
Yeah.
Well.
Yes.
I mean, where do we go for a vacation?
Well, you know.
Came and back.
Came and back and Little Cape Ann. That's right.
Anyway, Sandra, I didn't catch the very beginning of this incident with this man beating up on this woman. But
yes,
I know I followed the comments afterwards. And then, you know, it came on to policing in Cayman. And your last caller is on point. I'm going to say 99%. And the only part I do not agree with him with is, as one of your previous callers said, you know, back in the 80s and stuff, we had police, okay? We had police. The problem that we're having now is that we don't have any police. We don't have any leadership in the police force. And this trend has been going on for quite some time. And I am not going to blame this on the governor, any governor, because I'm going to go back to the 70s, the 80s, even the 90s. The governor sort of stood aside and let the commissioners do their jobs. And I don't think they really interfered, you know, unless there was something horrific. But the commissioner and deputy commissioners, they are not dealing with their subordinate. They are not being disciplined. They're not being trained, obviously, or trained badly. And they're not being penalized for their wrongdoing. If you will remember, because they've got this favorite thing now that they tell you when you call the police for murder, oh, it's a civil matter. Okay, they managed to learn that. Now, I don't know who's teaching them, because they seem to be going through some training academy before they're put in a uniform and in an AC car, but they haven't remembered anything else. But they remembered that it's a civil matter. And this has been reported more times than you and I could remember. And if we are sick and tired of hearing it,
yes,
no senior police officer can tell me that they haven't heard it also. And so it begs the question, why aren't they doing what should be done? First of all, they're trying to keep Caymanians out. Why? I don't know. That's why they're bringing in all of these other nationalities to fill all the positions. That is a disaster. That's a recipe for a disaster. You can't have someone police people they don't know. They don't know the culture. First of all, there is no trust within the police and the community. So somebody needs to go back to the drawing board and figure out where the architect went wrong and get it corrected. Because there are a lot of people who are very, very unhappy. And I am not suggesting in any way that there's going to be some revolution, but I can tell you people are tired of it.
Yes.
And we are all tired of it. I am a woman, and I can tell you what. And like I told a police officer, I said, I will defend myself, my life, at all means, by any means. You know what? He looked at me and he asked me if I have a gun. I said, well, is that your only concern here? I said, I can defend myself with many things except a gun.
Exactly.
Okay?
Wow.
So that's the kind of response we get when we call for help. And what does the writing on the car say? What? To protect and to serve? Whom? Who are you protecting and serving? You know what somebody should do? Perhaps take a drive around and see where our police cars are parked in the day and in the night. That's why when you call for police, they don't have any to send to you because they're already occupied. You know where. So.
Thank you, my dear.
All right. Have a great day.
Thanks. You too. Yes. Lots of really interesting comments. And without a doubt, we have some serious work that we need to be engaging in. And I think, hopefully the RCIPs has taken some of this constructive criticism on board. Via the Money says that they need to change the RCIPs policy. Most of the laws are outdated English laws. Well, we are still in English jurisdiction, so certainly let's keep that in mind. Denny says the MPs pledge allegiance to the king, not to the Caymanian people. We just saw the swearing-in ceremony not that long ago. Marshall says the quick response with the Jamaican police is that they knew the people would have gotten him if they didn't act swiftly. Cayman police know that the people wouldn't go after anyone, so they just drag their feet with the investigation. Point taken. Al Ebanks says Caymanians love being under England. The slave mentality will be hard for them to shake off. Independence is a bad word for some. I'll stay woke. All right, folks. That's what we've got for today's show. Thank you guys so much. Ms. Brenda, I saw your comment when you said it's a bit early for turtle meat. Well, the good news is I'm not eating it right now, although I'm so tempted because it is so delicious. Let me give a big shout out this morning to Mr. Dilbert McLaughlin from East End. He made some turtle meat yesterday and rice and beans, a little piece of sweet potato, and one little piece of breadfruit. And I can tell you, honey chow, that hit the spot. OMG. Oh my God. Now it was well seasoned, delicioso. What can I tell you? Oh, delicious. Reminding me of why they say the folks from good old East End are some of the best, and I do mean some of the best, if not the best cooks in all of the Cayman Islands. Boy, look, I'm gonna show you a little video of the turtle meat. Now, I don't eat all the turtle parts, so I pick out what I don't eat, but look, yeah. Yes, you got to cook it together to get the flavoring. Oh, the breadfruit looks so delicious. Yeah, boy. Thank you. Thank you so much, Mr. Gilbert. Brought me a little cake yesterday, and I said, well, if you have any left over, I wouldn't mind eating it again for dinner tomorrow. So hook me up. Late lunch. Hello. Of course, I don't eat cassava. I told him today we can save the cassava. I'm not a cassava fan, none at all. And so I just don't eat it. I hardly ever even eat cassava cake. I just don't like cassava. Ugh. I don't know, kind of bland. But anyway, delicious. All right, we're going to talk about more policing matters tomorrow. I think we've got a guest that's coming on to talk about sargasm. So yes, I think we are good there. And we should on Tuesday and Thursday, my apologies, have a special guest for you guys. Stay tuned. That's all I'm going to tell you. You want to make sure you tune in early on Thursday's show. As Brenda says, Denny, the police take an oath to uphold the laws, serve and protect the people of the Cayman Islands. Yes, they take a very different oath, but, so Joanna says turtle meat, assume it's good standing. Oh, honey chow. Delicious. Oh, just properly seasoned, and you mix that with that little rice and beans and you're good to go. I enjoyed it. I so enjoyed it yesterday. Thank you, Mr. Dilbert. All right, folks, that's what I got for you today. Please enjoy the rest of your day. Everybody's back to work now. Be safe out there, and we will catch you guys on tomorrow morning. All right, take care.
Thank you for tuning in to another episode of The Cold Hard Truth on Bobo 89.1 FM. Cayman's #1 talk show is live weekdays from 7:30 a.m. Never miss an episode again. Watch anytime on CMR's Facebook and YouTube channels for the latest show episodes. Don't forget to follow us online on our social media channels. And visit CaymanMarlRoad.com for all the latest news and community happenings.